welcome to this edition of Social Security Today. I'm your host, Jeffrey Rodriguez with Social Security. I'm the Public Affairs Specialist here in Orange County, and it's great to be with you again. I can't believe that we're already in November. We're closing out this year rather rapidly, coming to an end. And so I hope that everything that you're doing, your plans and everything are taking effect as you would hope and as you plan for the holidays. And there's a few things I want to touch on today just so that we can discuss and make sure that you're ready for next year when it comes to Social Security issues. So what we'll do is let's kind of jump in right away, and you know that I start right away with the My Social Security account. The My Social Security account is so important to us. There's so many things that we're continuing to add as we go along that you can have the ease of access and that you're going to be able to do to use your account. So I want to make sure that if you have not set up and signed up for a My Social Security account, please go into our website. You can do it online and sign up. It's very easy to access. You go right to our home page, and if you see there on the slide, you'll be able to see that when you jump into our home page, it's at the very bottom. All you're going to do is click on that tile where it says in My Social Security to sign up. You press there, and it'll take you right to the page that you need to see in order to develop and to file online. Now, if for some reason you're unable to file online, if it doesn't allow you to get through, it could be that there's some type of maybe a name mismatch, or the challenge questions that are posed, you're unable to answer them, then it's real easy. All you have to do is come into one of our offices, show your ID, and we'll give you an activation code. And then you go right back to that My Social Security page and you're able to set it up. So very easy to use. And once you sign in and once you have that account, from there you're able to print out, let's say that you need a proof of benefits. Your statement's right there. You're able to print it out. You don't have to go into the office, try to get it printed, or call and wait for it to be mailed. You can do it right at the ease of your own home right there and print it out and take it to wherever you need. Not only that, you also have the ability now, let's say that you've misplaced your Medicare card and you're unable to find it. You can order and request a Medicare card right from the My Social Security account. Some of the other things that we're adding in this year, we had added in the ability to print out your 1099. So many things that you can do on top of what we initially had started with, which were things like the changing your address to maintain that active. If you had to add or change your direct deposit, maybe it was you had to go in and view where you're at, your benefits. So many things that you're able to do. So I really encourage you. Now you're saying, well, that's all great once someone has benefits. But what if I haven't started yet? What if I'm waiting and I'm during this period and I'm going to be starting up soon? Why should I go in now? Well, that's a great question you ask, because if you haven't set up the My Social Security account and you haven't started benefits, there's things you can do prior to receiving benefits. And one of the biggest things is, as you sign into the My Social Security account, what you're going to do is, yes, you'll see the amount that you're eligible to receive at your full retirement age there. That kind of jumps at you real quick. And just like the statements that we used to mail out to you, that now we only mail out in 5-year increments from age 25, 5 years all the way up to age 62, then annually up to your full retirement age. In reality, you'll be able to jump in and look in view of those dates. But more importantly, you're going to be able to go to the earnings record tab. And when you pull up all your earnings record, you'll see each year with the amount that you had earned. That is where it's really important for you prior to receiving benefits to make sure that that is correct. Because we're going to base and calculate your benefit on those earnings. And so if those earnings are incorrect, let's say 30, 40 years ago, you were in between jobs or you had just barely started and you notice it's not on there and it's only maybe you earned 7,000 or 10,000 that year, and you're thinking, well, that's not even that much. It doesn't even matter at this point. Well, it could, because we index for inflation. When we're looking, especially if it's something way back in the start of your work history, it could be indexed and become one of your high years when we're totaling and using 35 of your highest years. Not like a lot of the private pensions or retirement plans that they use your last high 3 or 5 years. It's not how Social Security works. We're looking at the total of 35 high years. And so that may be one. So you definitely want to jump in, take a look, and get that going. I know I spend a lot of time on the My Social Security account, but it really is important. Not important just to me and to Social Security, but more importantly to you, because of that access and the way that we're going as far as technology and the ease of access. This really is going to become the way that you manage your own benefits. And so we definitely want you to start taking advantage of getting into the habit of going on to your account, checking to make sure everything's correct, that nothing has changed. You're going to be kind of your own police, if you will, to make sure that no one's committing fraud and has gone on and changed the address or the direct deposit, or just that you're receiving the right amount, that there's no error on your benefit amount. So please do us that favor. Go in, if you have not, sign in and create your My Social Security account. I think that you'll be very pleased and happy that you do when you realize how easy to have that information and the access to that information right at your fingertips. So as we continue, the newest kind of part of our website is, or online services, if I can say it that way, is our blog, and that's the Social Security Matters. And when you go to our website, there is the Social Security Matters blog that you can tune into, you can press and go into and read the information. And what that has there, as you see it, it'll bring up all the different information, things that we see are important or that we're getting word back from you in regards to what's important and what you want to see. And because those issues that matter to you, as we say, also matter to us. So Social Security Matters, our blog, is filled with information. And not only do you get kind of the updated information on some of those questions or issues, things that are changing, but you're also going to be able to go back in the archives, and maybe there's something that you missed that you want to review. You're able to do that as well. So use, whether you sign up and get the blog sent to your email so you can see it on your smartphone or your computer, or you're logging into our website and you're looking at the Social Security Matters, that blog information, I think that you'll receive a lot of information. You'll receive maybe sometimes questions that you don't know how to pose, or what you're kind of thinking, or maybe you've heard something about some changes in Social Security or pending changes. Well, this is where you're going to go and you're going to receive that. We have the Social Security Matters as well. Right next to it, where you're going to press to see that information, is also Social Security News. And so you can see one or the other, and again, you can go back and see the archives and view those as well. So the Social Security Matters, I hope that you're going in and you're reading those. Last month, I had a special guest with us that had come on to talk about Medicare, and specifically those Advantage programs, and she was from HICAP. I hope that you were able to receive some great information from Susan, who was with us. And today, what I'd like to just remind you, we're still currently in the middle of the Medicare annual enrollment, which is October 15th through December 7th. And so if you haven't taken advantage to review your Medicare coverage, if you hear kind of that, some of the people are talking about, oh, I made this change, or, did you hear about this? You can't really base upon, let's say you have a neighbor or close friend and you're having dinner and you're talking about Medicare, and they say, oh, I changed from this plan, or I upgraded to this plan, changed this. And they maybe encourage you, oh, it's a great thing for you, you should do it. I went through and I saw someone at HICAP, and they did a whole comparison. They told me this was the best thing. These were the options, and I chose this one. What I would really suggest is you can't base it on someone else. When the HICAP group takes a look and does a comparison, they're doing it for a specific person. So what might be good for your friend or that relative is not necessarily what's good for you. And so what you have to consider is looking at your own information And so what the high cap, as we mentioned before, what they do in this comparison is they're going to say, bring all your prescriptions, bring your bottles, everything in, your medications. Let's take a look at what things you're on as far as medications, what issues you have, health issues that you're concerned about, what type of plan you want to be in, and how you want that to work, whether you want to be in kind of that high deductible or a lower deductible so it covers a little bit more, less out of pocket, what that means to the monthly premium, if you'll have one or you won't. So you want to come in and talk to those experts. I can guarantee you that the Medicare system, and especially when you start talking about the Medicare Advantage programs, here in Orange County there's over 30 programs. There is no way that you're going to be able to identify or to study each of those plans and see how they would potentially affect you and understand how to apply apples or to be able to compare apples to apples. You'll end up trying to compare maybe one program or one plan that is totally different and has different coverages, and you think, well, this is a superior plan, but you don't realize that maybe you're paying more by choosing that when you could have something else that in a different plan that maybe has some other options and other plans that would work just as well or better for you cost effectively. And that's really what HICAP wants to do. So you still have some time. Call the 1-800 number there at Medicare, or rather at the HICAP. Get a hold of your HICAP here locally, and by doing so you'll be able to again either set up a program with them, set up a comparison time, whether you're going on or you're taking a look at the Medicare information, whatever you need to do. This is the time through this period, October 15th through December 7th, that you have an opportunity to jump in and to determine, am I still on the best Medicare plan? See, what often happens, and I don't remember if we really went into this, into some of the depth of this the last time, or if you spoke to someone between now and then, but what happens is the Medicare Advantage programs or those providers, they'll change something just slightly. They might increase a service or a prescription cost that you're taking, that you're using, and they raise that just a little bit for you. But what they'll send you in the mail is they might send you information, and they're part of their plan, and they'll send you information and say, you know what, we've lowered the cost in this area, and we lowered the cost by X% on our prescriptions. And you're thinking, you're taking for granted that means that you're going to be paying less for prescriptions or that they're taking care of you. But we do have to remember that all of these plans out there, they are there to make money. And so they're going to look at what's best for them, not necessarily what's best for you. And because at Social Security really desire what's best for you, I would strongly suggest, please, during this open enrollment period that you have time, speak to a counselor at HICAP. Make sure that the plan that you're under is really truly the best for you, as well as saving you money. And I can almost guarantee you, if you haven't reviewed this, and let's say you've allowed 5 years, 6, 7 years to go by, and you're just kind of complacent in the plan you have, you're okay with it, it works well for you, you might be surprised at what you could save. And maybe it's not entirely changing providers. Maybe you like the plan or the program you're with, the medical provider. Maybe it's just the prescription component out of what you're receiving on Medicare, and maybe you're potentially able to change just the prescription coverage so that you get a better plan to cover the prescriptions that you use or those medications that you're currently taking. So I would strongly urge you to please take a look at that. Not only that, consider you might have 1 or 2 new prescriptions. We know how that happens. You're taking a certain one, it's not as effective, and the doctor changes you to a new one, and you forgot that you've changed maybe 2 or 3 different types of medications, and maybe the plan that you're under, those are a higher cost where you could get another prescription plan that would cover those at a lower cost, less out of pocket for you. And that's what we really want. We want you, we understand no one has enough money to be burning and throwing around, especially when it comes to the high cost of prescriptions and medical coverage. So please take advantage of this opportunity that you have, and know that when you make these changes from now, October 15th through December 7th, they're going to be effective starting next year, January of next year. So you ask yourself, what things can I do? And as I said, really take a look at your Medicare health care coverage. Is it what you want it to be? We shared the numbers with you, the HICAP number, that 1-800-434-0222. If you haven't, jotted that down, make sure you take that down. That's the people to call. It's no cost to you. It's a nonprofit organization that is set up through the Council on Aging to help you understand the whole Medicare scenario. So please use that to your advantage so that you're not paying for something you don't need. Now, in kind of changing gears here, and if you have any questions, reach out to your office as well, your Social Security office. Hopefully you have your local Social Security office number, whether you're using the Mission Viejo or for some reason you're using Fountain Valley or one of the others. Make sure you have their number, and if you have questions, and you need to, give them a call. If you're not finding the answers online, or you searched or you're not really sure of the answer that you got maybe from someone else, another organization, check with Social Security, check with Medicare, and we'll help you out so that you can understand that and get the right information. Usually from our own organization and agency is usually best, because the others may have a good understanding but not get it quite exactly right. The other thing that, as I said, kind of changing gears, in November, we know that we celebrate Veterans Day, and it's coming up rather rapidly. And so to everyone that has served our country, from the bottom of my heart, I thank you greatly. Thank you for serving our country. Thank you for putting your lives at risk. The families that have sacrificed, and as you went out and you protected our country, that you presented and represent our country in that military force, thank you. Wherever you served in the military, whether it be the Army, Navy, Air Force, Marines, Coast Guard, however you have served, we greatly appreciate that. And here at Social Security, we are doing our best. We greatly respect our veterans, and so as we help and we extend out, one of the areas that we really have, I say we haven't perfected it maybe yet, but we really have gotten good at, is helping those that are in that wounded warrior category, those that have served our country, gone off, and come back with some type of disability while serving our country. And what we've really done is to streamline how we take care of them, because we do appreciate those that are out there serving our country. So we move them through this process at an expedited manner. If they come out and we see that they're going to have greater than that 90% disability, then we want to get them through and get them their money. You read or you hear in the news about maybe a person that has not been able to move through, not so much through the Social Security system, but maybe through the Department of Defense system, and it's taken them long. I know that I heard recently about one of those situations, and it's really unfortunate because these people are sacrificing. The pay isn't that great. They're not making huge money out there. It really is a calling that they say, hey, I'm going to serve our country in this way. And I think that Social Security has truly understood this and has partnered with the VA and other agencies to say, let's get these people that have this need, these veterans that come back and return that have this need, let's move them through in a timely manner. And so I take great pride in that. We are doing, I think, a fantastic job with the Wounded Warrior program, and coupling with and taking a look at how to move that through. And when you consider it, we've been doing this now for quite a while as far as the Wounded Warrior, and taking a look at active service members and using this expedited process. It's actually been 14 years that we started this. So it's one, again, that we've worked on and we're proud to say that we appreciate our veterans, and that's how we're trying to do that. Now, I'd like to, as we kind of start to wrap up, I'd like to take a couple topics and explore them a little bit before we close off and end today. And the first one's in the area of retirement. And so if the question, and we'll use kind of the question and answer format because it kind of works well for us. So in the first question that I have in regards to retirement, the question is, what can Social Security do to help me plan for retirement? And so if that's your question, you're saying, well, I'm getting ready. How can I truly plan for retirement? What can I do as far as my Social Security benefits that I'm going to be receiving so that I can make sure that I'm maximizing, that I'm getting the best or the most out of my scenario? And one of the questions when people come through and they ask this, how can I plan? How can I make sure that I'm receiving, the best opportunity or taking the best choice for me? And what I always answer, or the way that I like to answer is, I remind you that you're an individual. What works well for your neighbor, maybe for a brother, brother-in-law, sister, sister-in-law, your family members and friends, isn't always going to be the best plan for you. So when you're looking at your Social Security, retirement, and how to set that up, you need to understand that it is specific and is going to be designed and has to be designed. You take a look at it individualistically. It has to be for you. So you're looking at a lot of factors. You're looking at your own health. How long does your family history and how about your own health currently? How much time do I think I have that realistically, if I say my longevity, how long will I live? Those are some of the hard questions, and that's why I think sometimes we shy away from it. It's kind of, we're in a culture where death becomes kind of taboo, so to speak, at times, and people are afraid to talk about their own death because of the whole question, what happens after. But we can't allow that fear or maybe that anxiety to detract us from saying, but I have to figure this out, because that's one of the biggest questions when you're dealing with and how do you plan for retirement is your own health and how long do you plan and how much money do you need. Do you need money up front? So maybe you're going to take it at a reduced benefit, even though there's a penalty and a reduction for taking it early prior to your full retirement age. Maybe that's still the best thing because your family history, no one has really lived too long. Or maybe you have a lot of health issues and you're saying, it's just best if I get this now and I need the money now. Maybe it's a financial situation. You say, but I need my money now. Great, then that's what works well for you. Maybe you're able to say, I'll wait till my full retirement age. I'm still working. I'm going to continue working. Well, then it works out for you. That's great, because then you can start receiving your benefits. You can continue working. There's no limit for earnings after your full retirement age. So you say, great scenario. I'm able to continue working. I'm getting my Social Security. I'm going to invest it, or I'm going to use it in this way, or pay off some things so that when I fully retire, now I know that everything's in place and I don't have to worry about maybe certain bills or other costs that I have. So that may be it. Maybe some things that you want to do prior to your full retirement. The other is taking a look at the couple. If you're a couple, if you're married, then it's looking at how will my starting my benefits affect my spouse? Will my spouse have access to my account at that point? And so is it best for me to start maybe earlier so that my spouse can receive, or do I wait till full retirement age and use the different options that are available to me? So no matter what you're doing, there's a few things that you can use in what we call our online services. You can go through the My Social Security account, and there's estimators for retirement there. But there's also, if you just go to our website, you're able to use the Social Security estimator as well as the Social Security retire option, which is to be able to take a look at that whole planning part and saying, here's how much I would receive at this point. Is that how much I need? Because maybe you have an amount in mind. Maybe we've already taken a look and you say, well, I need it to be at $1,800. So you're looking and you're using the estimator and that planning device to say, at what point will that become, my benefit become $1,800? And so you look and you say, well, it's at 64.5. Then you can know that you can either take it there or you can wait for it to build in value a little bit, whatever your option is. And maybe you say, well, I have to wait for some delayed retirement credit, and it won't be until I hit approximately somewhere around age 67. And so then you say, well, then that will be the point at which I start to receive at. So whichever route you're going as you start to plan, you need to consider for yourself, at what point will I need X amount of money, or at what point do I want to use the money? A lot of people, when they're planning their retirement, the reason that someone does a reduced benefit is they say, although it's reduced, I'm going to use this money at this point. If you don't need the money, if you don't need your Social Security benefit money, then I can almost say it wouldn't make a whole lot of sense to take a reduced benefit prior to your full retirement age, because you're locking yourself in at a lesser amount. So you maybe should wait till later and let it grow in value to either you need it or you maximize that full retirement age at 100%, or with delayed retirement credit until age 70. So whichever route you're going, again, the main thing is know that it has to be set up and built up around you. The other question in regards to Social Security that we have is Medicare. So the last question I want to pose here is, what can I do if my Medicare prescription drug plan says it won't pay for a drug that my doctor prescribed for me? So if you're in this scenario where you have a prescription and they're saying, you know what, I need this, my doctor has prescribed it, but under my plan or my drug plan, Medicare won't pay for it. What are my options at that point? What can I do? Look, Medicare prescription drug plan decides that they won't pay, then this is what you can do. You have to take a look at your plan. You must take a look at what your prescription plan is telling you. It'll give you a notice if it's not covered, a letter, and as you see, I kind of highlighted there for you to understand or see it better, is there needs to be, you're going to look at this letter that says Notice of Denial of Medicare Prescription Drug Coverage. When you receive that letter that they will not cover it, you're going to review that and find out, is this really at the one that Medicare should cover and I need to appeal it? Or is this something that I need to talk to my doctor and say, is there another way that we can go about, maybe another prescription that is under, because if it's important to you at that point for your health, then maybe you need to look at looking at not so much waiting for the appeal process and decision, but rather going and saying to your doctor, what other options do we have that might be covered? And work with your doctor under that. Take a look and make sure. But if it should be covered and you receive that notice, you need to contact Medicare and appeal that. Going back to kind of HICAP, they can help you in that appeal process. Well, that's all we have time for today. And as we close, I wish you the best, and I trust that this November will be good for you, this open enrollment. You take advantage of the Medicare, and I look forward to seeing you next time. We'll be in December, the end of the year, the last month. So take care, and God bless Laguna Hills.